We have such a treat for you today. The Bartlesville Literacy Services Department of your Bartlesville Public Library is bringing to you today a wonderful and exciting health and wellness class. We are so excited today to have Tiffany Broughton here, who is a hearing instrument specialist. And I have to look at my notes so that I get that just right. Tiffany is from the HearingLife Testing and Hearing Aid Fitting Company, and it's actually just called HearingLife. But she's going to talk to you about some of the questions that you might have. I think she'll be answering some about your own hearing, what to do if you think that you may be experiencing hearing loss, how to approach that, and then how to solve the problem in its entirety. I think she'll have some good information for you. And I know there are a lot of you out there who are thinking, I might feel like I have some hearing loss. I might feel like I'm not hearing as well, but I really do not want to approach this subject. Well, Tiffany is going to make this easy for us today. I wanted to let you know that Tiffany has a bachelor's degree from KU in speech, language, and hearing. So what she says to you today is true. So get your friends, turn on your Facebook, and let everybody be seated, and let's hear what Tiffany has to say. Without further ado, may I introduce to you Tiffany Broughton.
Hello, my name is Tiffany Broughton. I went to the University of Kansas for speech, language, and hearing. I know this is a kind of a different role. A lot of people don't think about their speech or their hearing. But actually, when I was younger, one of my classmates had hearing instruments, and I watched him progress, from the old hearing aids to the ones that are coming out these days. And he was really able to improve his quality of life, academically, socially, and even athletically. He was able to play sports. So I loved that. So I went to the University of Kansas and I got my degree. And now I am at HearingLife in Bartlesville, Monday through Friday. What I'm here to talk to you today about, though, is just hearing loss in general. A lot of people don't put a lot of thought into it. I know sometimes, if you have a problem with your eyes, you'll immediately go see your eye doctor. If you happen to hurt your finger and the fingertips weren't, feeling anything, you might go in and, go see somebody about neuropathy perhaps. But a lot of people push off their hearing, and there's many factors for that. First off, it's good to say that your hearing is so important. It not only helps you, remain safe because you're able to hear things around you, but it keeps you, included in your groups, able to, still go out socially and not feel like you're missing out on conversations. And you're also able to just really, it helps with your health in general. There's a lot of balance issues that, can be addressed when you go and see, an ear, nose, and throat doctor or somebody who treats hearing. Now, the Campaign for Better Hearing is a national campaign, and what it does is every time that somebody goes and gets their hearing screened, what they do is donate $5 of that test, and they go ahead and put that towards some hearing aids for some people who are in need. And it's really great. I have some coworkers, in Arkansas and around the country who are able to get some of their patients, free devices that will help them hear so much better, because sometimes, money just doesn't allow for some hearing devices. Now, the first thing that we should talk about, though, now is your ears. I know a lot of people will go around and they'll still be using cotton swabs. And you might, there's some hands up in here. Everybody does it, but it's not recommended. We know this. Number one thing I could say, if you feel you have a lot of earwax buildup and you're not sure, first go and maybe have your hearing tested. The first thing that any hearing professional is going to do is take a look in your ears with an otoscope. Now, these can be handheld or it might be one that's video. In my office, I have one that's video, so you're able to see exactly what your eardrum looks like in your ear canal. So it's really cool because a lot of times people haven't seen it before. So they'll take a look in your ear canal, make sure that there's no wax or anything obstructing it. However, if there is a lot of wax in your ear, number one thing that people recommend to do is go out and get it irrigated or treat it yourself at home with something like this. It's like Deep Rocks. It's sold over the counter. You use a little syringe and you basically just soften up your earwax and make it so that it can move out on its own. Now, that is just the outer part of your ear. There's more in the inside. So here, I have a little diagram of your ear. So right here, this is of course the outside part that everybody sees. And then you go in deeper, you have your ear canal. With your ear canal, you have a tympanic membrane. Now that is, that's where the sound goes and reverberates and then sends it into your inner ear. Your inner ear has 3 tiny little bones that are the size of a dime all put together. They can all fit on a dime. They're very small. Now past those little bones, you have your semicircular canals over here. And in this inner ear organism, this is where some of your balance is. So you have your cochlea and your semicircular canals. There's fluid in here that helps you maintain your balance. So a lot of people don't know that hearing and balance are tied together, but they most certainly are. Are there any questions right now?
Well, I think I have one. I didn't understand that balance in the ear went hand in hand, but it does kind of make sense.
Yeah.
So I don't know if this has anything to do with it, but you know when you get up in the morning and you get your first step down, sometimes you sway a little bit. Does that have anything to do with the ears?
That might have a little bit to do with your ears. What I would suggest is you bring that up to your doctor. What they might do is refer you to an ENT or an audiologist. They treat balance disorders, so they have different therapies that they can do, different tests to see. But definitely when you wake up in the morning, I can see that.
Very nice.
Yes.
So if an elderly person had hearing instruments and didn't have them on, let's say, and they got up in the morning and they were more prone to imbalance, then it might be that they could fall. Is that, does
Yes.
that connect
So
pretty well?
It does. It all kind of winds in with each other. So perhaps not just having the hearing aids on just for that brief moment in the morning wouldn't make you dizzy, but prolonged, exposure to noise and things without treating your hearing loss and not having the, everything up to snuff at the levels that it needs to be, that's when you might start to see some of those balance issues come in. All right. So let's explain what an audiogram is, because this is how your hearing is tested. When you go in and you get your hearing tested, the first thing that they're going to do is either put inserts into your ear or perhaps kind of like earmuffs headset. And what we'll do is go ahead and we'll do pure tone audiometry, and then we'll do speech testing, bone conduction. There's different tests that we do for different reasons. We do air conduction testing because this tests how well you hear through the air. Now we also do bone conduction testing because you hear through the bones in your skull as well. I know a lot of people don't know that. So that's another exciting test that I offer at my office here. But this is the sheet that you're going to get your results on. Now, it's a little graph, and over here from the top side to the right is kind of like keys on a keyboard. So you have your low tones, and then moving over here we have our high tones. This line up and down, these are kind of like dials on your volume control. So you have 0 to 20. Now anything that falls within that range is normal hearing. From 20 and below, these are areas where your hearing loss is affecting your hearing so much that your speech might be affected. So from 0 to 20 and then down, this is where we see a lot of the hearing losses. So I'm going to just go ahead and draw in a hypothetical hearing loss. Now, when you're looking at hearing aids or any sort of audiogram hearing test, there's always going to be two distinct colors, red and blue. So your red is going to be your right ear, and blue is your left ear. So the easiest way to remember that is right and red. So let's say that this was your hypothetical hearing results. What we'd see here is this is pretty typical. This is what we might see with the noise-induced hearing loss, or one that comes with age, which is presbycusis. With this, you see that, of course, you're dipping down into these lower areas, but what you're mainly missing out on is a lot of the speech sounds. I just drew in this little banana. Now go ahead and pretend that all of the speech sounds are right here in this banana. So you have, your F's and T's over here, and you got your vowels over on this side. When it gets to be hard for people to distinguish, did they say sit or tick, or it's hard to tell which word was said? This is because usually with this type of hearing loss, which we see quite a bit, it's hard to bring these sounds back up to where you're able to hear. So this is what a hearing aid does. They essentially take these levels and move them up to where they're normal. So in certain places you'll have different amounts of help, and in other places you'll have less, but that's essentially your prescription. Now, with speech testing and audiograms, another part that your hearing professional might do a test is to test your word recognition scores. So what we do then is we present some words to you in the sound booth at a level that's nice and comfortable for you. We verify that this is your most comfortable level, basically where you'd set your TV. And then we present some words to you that are based out of the phonetic alphabet. So all those sounds are covered in that list. And what this lets us know is, okay, well, perhaps you have a mild hearing loss, but you do still have excellent word recognition scores, or maybe you have good word recognition scores. Your goal then is to make sure that you preserve those word recognition scores, that speech understanding. With hearing, it's kind of like you use it or you lose it. Everybody in the industry kind of says this, if you aren't presenting sounds and keeping your brain active, that's when we start to see some of the decay in the speech understanding and the cognitive decline. This is why lately there's been a lot of research coming out about the link between Alzheimer's, dementia, cognitive decline, and hearing loss. They are related just as they are with balance issues, hearing and balance issues, hearing and cognitive decline. Yes. So I like to think of, the cognitive decline and the hearing being interrelated like this. When you see somebody who comes in and perhaps they've been putting off, getting their ears tested or their hearing tested because they're just kind of scared. They're like, I think I got a problem and I don't want to wear a hearing aid, so I don't want to do anything yet. Of course, you're missing out on sounds and that you're not able to communicate in conversations, but the other bad side is that you're not keeping your brain active. So then you start to lose some of that speech understanding. So that's why it's always best practice is to test your ears at 60 years. So if you are over the age of 60, you want to annually get your hearing tested. What you'll do is you'll just go in for your first test. You'll call that your baseline. And so that you'll just monitor it year by year and just make sure that if you are needing hearing, treatment, which is usually through hearing aids, you can get that for you and make sure that you're able to hear better.
Question?
Mm-hmm.
Is this testing, can you use your insurance or is it out of pocket?
So the testing is free. That's because I partnered with I'm partnered with the National Campaign for Better Hearing. So that testing is always going to be free at my office. Other offices, definitely, they are able to bill, your hearing exam. Some insurances are now covering hearing aids more than we thought. A lot of them are, providing discounts and that type of thing towards hearing aids now, which we've seen, with some of the new, with what's coming out in the news. So that's great. What I would say is when you go to schedule your hearing exam, just go ahead and let whoever's on the phone know, hey, I do have this insurance, and ask them to check for you. It's not a big hassle. At my office, Susan will check that for you. She goes and figures out what you do have, and then we go from there and let you know. If you did have a loss, you would be able to use this discount or perhaps this insurance benefit. And depending on what your insurance covers, you are able to just bill through them. Yes.
Okay. A lot of people that are elderly are just on Medicare.
Mm-hmm.
Do you know if Medicare helps cover it?
There's some Medicare supplements that have been covering it lately. I don't know the exacts of this, and I'll be honest, this is what Susan's a little bit more in depth with that, because I definitely focus on the hearing and the testing of the instruments, but some of these local plans with the Medicare supplements do have that insurance benefit for hearing aids now. I know there's local ones that do, so yes.
Can you, you did a nice job of explaining this, but could you get more specific? And if you can't, I understand. If you have an active mind and you're busy and you interact with people a lot, but you have a small bit of hearing loss, are you saying that anybody who has small hearing loss is going to connect to cognitive decline eventually?
Well, eventually, yes. Everybody's word recognition scores and their speech understanding with age are going to decline. That's just what we see. Am I saying that if you have a tiny hearing loss and you don't wear hearing aids, are you going to get dementia immediately? Absolutely not.
Okay.
Absolutely not. Don't think that. Now, there are some scare tactics and things that, in the media, ignore those. The important thing is that, yes, you do go and eventually get your hearing checked and treated. But the thing is with hearing aids, sometimes people just simply aren't ready. And that is just the case. If you think about Sweden and Denmark, where they have, I think it's called universal health care, their government pays for everything. The hearing aid adoption, we call them adoption rates, that's how many people decide to wear hearing aids, are comparable to the United States, where everybody's paying out of pocket. That's just because there's many factors as to why people don't want to do it right away. Perhaps they think they're too young. They're simply not ready financially. They might be in denial. They're like, oh, I know my kids say that I can't understand them, but I think I'm doing fine. I hear just fine. And so that's usually where a lot of people are. And then usually you just move into that acceptance area. And usually it's kind of around the time when somebody really finds that they're just having a hard time. Like, for instance, with a loss like this, I imagine it would be so hard for a person like this to hear a grandchild, with their very high-pitched voices. So this might be a driving motivation for someone to come in and address their hearing loss.
So are there hearing instruments that are, you can't see them, that are close to invisible?
Yes. So I brought some with me. Now, these are just ones that I think are very invisible, and these are not custom fit. You definitely seen people who have their custom pieces here, and perhaps it fills up their ear. There's some that go very deep into the canal, but this one right here I think is very discreet. What you do is it kind of just sits over the top of your ear, and then you put it in. I'm going to walk up there so I can kind of show. So Yeah, it's in my ear, and you're not really able to see it. There's a thin little wire that comes down here, and then the wire is pretty much clear, and the little dome pieces on the end are also clear. So it's pretty much invisible unless you look from the back side.
I want to ask, what age would you give somebody who said that you give a test?
Definitely 60 years old, but I would recommend if you're in your 40, 45 years old, that's when you start to see a little bit more of that noise loss and noise-induced hearing loss start to set in. You might want to come in around 45 years old. At that point in time, if you don't have hearing loss, the person who tests you is just going to say, congratulations, you don't have hearing loss. We don't need to address anything today. And that's always great news. But they'll ask you to come back every year or so to just update and monitor that. Because once we do find out that you're missing out on some sounds of speech and you're only understanding maybe 70% of the conversation that's presented to you, that's when you want to improve it and make sure that you do get all that conversation and you can fully be engaged with your loved ones and your family members.
So if you're sitting at a restaurant or you're engaged in conversation and there's a fairly loud TV on in the background or rock music, let's say, in the restaurant, and it's difficult for you to hear conversation, is that an indicator that you have hearing loss, or they have their music up too loud?
So most everybody has a hard time in those situations, I'll be honest with you. What you might be having a problem with is speech and noise. And so there's a test that, we can also do. If you go in and you indicate, like, I feel like I don't have a problem maybe in general, but I really think I have a problem with speech and noise, there's a quick test that we can do to determine just exactly how hard it is for you. Because with certain people, people who are still, going out to bars, going out and being at events, being very active in the community, in those noisy environments, those are the people who need a bit more help from their devices. So these are the people who usually you would recommend something with more technology in it than somebody who perhaps stays at home and, mainly just interacts with the husband or the wife, goes to church maybe once a week, but mainly is just staying at home and watching TV in a quiet environment. So those two people would need different help. But definitely speech and noise, that's a test that you can ask for. And then using that can also help fit your hearing aids better. What it does, this test, I'll just explain it to you. A man says a sentence and you have to repeat it back, and there's just a bunch of noise. It mimics that restaurant, that bar kind of vibe, so that you can see exactly how hard it is for you to hear in that noise. Now, do all hearing aids help you in those noisy situations? Some of them do not. Some of the older ones, as time goes on, with computers and technology, everything improves. So what we see is some of these older devices that are we used to fit people with, they weren't as good as some of the new ones. All the hearing aid manufacturers have very good top of the line hearing aids that are always going to help you. Your best bet if you are in those noisy environments is to let your hearing professional know right away, like, I'm always out and about, because you will need more help from the hearing aids.
Okay, so I have another question. Both of my parents, one is in their late 90s and the other one is deceased, but in their very late years, they were hearing devices, and the comments that I heard them make were that they wanted to take those devices out because the other noises that they were hearing extraneous were driving them crazy. Mm-hmm. And whatever that might have been, mechanical noises, TV, or whatever. Mm-hmm. Then the other parent, who can hear absolutely nothing without her hearing aids, when she puts them in, then certain noises just drive her crazy, like all of a sudden she can hear the washing machine, the movement of the washing machine she'll beg you to turn it off because it's just driving her crazy, but she can't really hear what you say. Now, I know she has a good audiologist, but are there issues with those instruments that create sounds that are just as upsetting to the person trying to wear them, or does that make sense what I'm asking you?
So I imagine, especially, with a very profound loss, it has been years, maybe decades, since she's heard some of those sounds. And what that is you basically have to kind of retrain your brain to ignore it. Like right now, I can hear the air conditioner running in the fridge over there. And if I had hearing devices on, I might, they were brand new to me, then I'd be like, whoa, that's pretty loud. But you kind of just have to get used to it. There's plenty of adjustments that your audiologist or your hearing instrument specialist can do to help you with those. But the number one thing that you can do is just make sure that you wear your hearing devices. Like basically, if you're awake, you put them on, because it's kind of like rehabilitation. It's like anything like physical therapy. You've got to get used to things again. So some of those devices, they definitely do amplify it a little bit too much, some of those low sounds, but you are able to adjust. But mainly the number one thing is that you have to get used to hearing these sounds. And the other really big thing is get used to hearing your own voice too. Because if you think about it, if you had hearing loss and you hadn't heard your own voice for a while, and then you go to put on hearing aids, a lot of time people are like, whoa, my voice is annoying. But it's just because they haven't heard it in quite some time. Like, for instance, if I'm able to watch this later, I'm sure I'll say my voice is annoying because you know what I mean? You just hear yourself a different way is kind of what's going on.
Well, you've probably heard all of these excuses from people, but I would think that it might be better to start them younger instead of older so that you have the patience to make that change, because I find that the more elderly, they don't have the patience to deal with it.
Yes.
And then the other thing is, they would say to me, well, I spent all this money on this and I don't even want to wear them. So they end up not getting any help and having spent the money, and they still can't hear you talk, but they won't wear the aids because of the extraneous sounds that they think they're hearing.
Yeah. So I think, was there a question to that?
Well, not really. I'm saying how it was a comment that,
They do.
The answer is, should you start younger?
You should start younger. There are so many Bluetooth capabilities and different things that you can do with your hearing aids now. And just the simple fact that if you wait to get hearing aids until your arthritis is completely flared up and it's, very hard for you to use your fingers, it is best for you to train your brain early on. This is the new way of hearing. This is how I'm going to have to put these devices in. This is how I train my fingers to make sure that these devices are in. So yes, starting younger is much better, especially too with this Bluetooth connectivity, because people now, instead of, having their hearing aids in and then using their cell phone and trying to figure out, do I put it over here by this microphone or down here where my normal, canal is, now you can just take the sound and put it directly in your ears, like you were wearing some Apple iBuds or, those pods. And it's essentially just, a Bluetooth accessory. You could listen to your podcasts, music, phone calls, all of that through your hearing aids. And you can also do that same thing with your TV. I know there's a lot of people who, of course, TV is very important, because that's how you spend your time at home with your loved ones. They're not able to hear it. Now they make, accessory devices for hearing aids where you're able to plug into the back of, your HDMI or your optical cord and plug that in. And then now the sound from the TV can go right into the hearing aids, and it's still in the sound in the room. It's very nice. So it's nice because a lot of times, husbands and wives will be like, I gotta go watch TV in the other room because my husband's, got it at 55 and I'm used to it at 12, So that helps people, reunite and get to spend time together again, because I see that a lot. People are like, well, my wife has to go watch TV by herself because I turned the TV up too loud. And it would be much better if you would just get to hang out and, be able to hear well at the same time.
What do you think about those over the counter, those hearing aids, and just give them like one thing, is that helpful?
I think you could think about them kind of like people think about readers. These over-the-counter hearing aids, they're essentially just a volume control. It boosts the volume up, and unless you have a very mild, flat hearing loss, they really don't provide a lot of benefit. If you remember what I was talking about here, how this is kind of a typical loss where people have that high frequency dip where it's really severe down there, it's too difficult for the over-the-counter hearing aids to boost that up. But yeah, I would say just think about them as readers. And I wouldn't recommend purchasing them, to be quite frank.
So did I hear you correctly say that as people age, they all have some kind of hearing loss?
Yeah, usually. Basically, anybody over the age of 60 is going to have a small degree of hearing loss. It just comes with time. I mean, even if you're just driving and you got your window down, you're driving around, that can cause you some hearing loss there. And it's just something you wouldn't really think about, but over time, just with noise exposure, little bits of hearing loss, very normal.
So I do a lot of trainings, and as I'm speaking in the audience, especially now that they have masks on, this is strange, and it might just be because of the mask, but I will think somebody on this side is talking, and I realize, no, it's that person over there talking. It's hard now to differentiate where the sound is coming from. And some people, I can hear them perfectly well, and others, the tone of their voice, and I catch myself saying, could you repeat that, please?
Yeah.
Because it's like, I can't hear what you're saying.
And that's the way it goes. Certain people's voices are harder for other people to hear. And, you may be like, I cannot hear my cousin Rachel at all, but I can hear, her brother Tim completely fine, or vice versa. It just depends on the configuration of your hearing loss. Like I showed you this one here, this would be somebody who would have a problem hearing maybe some women's voices or children, but you can imagine if it was the other way, they might have, a hard time hearing men's voices, so.
Right, frankly, I don't hear men's voices very well. I've noticed that with my husband, my son-in-law, and my son, that I have to ask them to speak up a lot. And we got to be joking with them, saying that they were mumblers, and then I started thinking, maybe they're not mumbling, maybe I'm not hearing them. So
yeah.
Tell me about that.
So I would imagine if you're not able to hear, your son, those male voices, you might have a bit of that lower frequency hearing loss. You might still have a little bit of the high frequency loss, but what I'd imagine is rather than sloping off so quickly, it's kind of more gradual. And it has a little bit there in the lows, but you're definitely, welcome to come get your hearing tested, and I'll let you know. It's very nice too, because I love, people come in, I say, tell me a little bit about your hearing, like what's hard for you to hear. They'll explain things to me, and then I test them, and I'm like, this makes complete sense. This is why you can't hear this, and this is, why you can hear that. I love it. I love this job. Now, the other thing too, I have this right here. We need to discuss hearing protection. If you work in a noisy environment, you're going to need to wear some hearing protection, whether it's these foam tips or perhaps your work regulates and they tell you that OSHA says you have to wear these, this headset here to protect your ears. This is so important, very important. Just always, if you're shooting a gun, put on some of these. If you're at a concert, I understand that you don't want to wear some earplugs. You purposely went out and you want to be in that noise. But anytime that you're doing something in your everyday life that can cause you hearing loss, or is just very loud noises, go ahead and protect your ears. We have these little foam foam tips, they're pretty good, but like I say, you can also get custom pieces or some over the ear protection. Another fun fact too is that bananas, the potassium in bananas can help regulate your inner ear. So it kind of helps a little bit with that balance. So if you ever see me out and about with bananas, that's why.
Yeah. Awesome. Okay, so are you at the end?
Well, we want to thank Tiffany, here I am, for bringing such an informative class today. So many people I know are going to want to know more about this. So could you give people a way to connect with you, either by telephone or your website?
So you are able to call me at my office, but what I'll do is I'll just kind of zoom in on my crowd here. You can give me a call here. You'll probably end up speaking with Miss Susan, but our phone number is 918-331-0899. And we're over by McAllister's by the old mall. So that's where we are.
And if somebody was unable to get that, you can call the Literacy Services Office at 918-338-4179, and we'll be happy to pass your information, Tiffany, to them. We want to thank you so much for coming today. This has been so interesting and so informative. And you know, our health and wellness classes from Literacy Services here at the Bartlesville Public Library are made possible by the Institute of Museum and Library Services, the Oklahoma Department of Libraries, and the Bartlesville Public Library. Thank you, Tiffany from HearingLife, for coming and being with us today, and we hope you'll come again. Maybe there's something else you can share with us.
Definitely. I can talk for so long about hearing, so anytime.
Well, wonderful. Thank you.
All right.
And thanks to all of you for joining us at the Bartlesville Public Library Literacy Services Department.